Hi, I'm Peter Gloviczki from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery, Venous and Lymphatic Disorders. We are pleased to introduce to you the latest issue of our journal with several excellent papers on venous and lymphatic diseases. The Editor's Choice article in May is the first 10-month results of the Vascular Quality Initiative Varicose Vein Registry, a multi-center study written by Andrea Obi, Thomas Wakefield and colleagues. The study is important since this is the first report of early data gathered through the new VQI Varicose Vein Registry, co-sponsored by the American Venous Forum and the Society for Vascular Surgery. 1,803 limbs of 1,406 patients were studied. Most patients had C2 or C3 chronic venous disease. 130 limbs had healed or active venous ulcers. The procedure was an outpatient procedure in 99.9%. Most frequently, in 54.4%, it was performed in the office, and in 37% in a hospital setting. 74% of the procedures were done under tumescent anesthesia and 18% under general anesthesia. The most frequent vein treated was the great saphenous vein in the thigh in 55.8%, followed by the small saphenous vein of the calf in 17%. Most patients, 55.2%, underwent RFA, 33.9% had laser, and open surgery was done in 8.7%. There were 3 hospital admissions and only a few mild complications. Follow-up was short, a mean of 45 days, but both venous disease severity scores and patient-reported outcomes improved after interventions. Based on these early results, the authors concluded that modern-day varicose vein surgery is characterized by predominantly endovenous treatment of axial vein reflux, phlebectomy for clusters, and substantial early improvements are achieved in both physician and patient-reported outcomes. As you probably know, in 2017, you can earn your CME credit by reading one of the papers in our Venous Journal that you can also download this month free of charge. Our CME paper is entitled Predictors of Failure and Complications of Catheter-Directed Interventions for Pulmonary Embolism, written by Dr. Evgerinos and colleagues from the University of Pittsburgh. In this single-center retrospective study, 102 patients were treated with catheter-directed thrombolysis, 14 for massive, and 88 for submassive pulmonary embolism. Catheter-directed intervention failure occurred in 14.7%, in 50% with massive PE, 99.1% in submassive PE. Major bleeding occurred in 6.9%, in 21.4% with massive, and in 4.5% with submassive PE. Mortality in patients with massive pulmonary embolism was high, 21.4%. Failure of catheter-directed thrombolysis to treat pulmonary embolism was associated with massive pulmonary embolism, prior pulmonary disease, and contraindication to lysis. Bleeding was associated with age over 70 years and with contraindications. Based on these results, the authors suggest avoiding catheter-directed thrombolysis for pulmonary embolism in patients with a contraindication to lysis, in patients with massive PE, and in those with prior pulmonary disease, and also in patients over 70 years of age. The next article is entitled VCLOSE Trial 12-Month Outcomes of Cyanoacrylate Closure versus Radiofrequency Ablation for Incompetent Great Saphenous Vein, authored by Nick Morrison and his colleagues. This is a prospective randomized multi-center trial that compared results of 2 interventions in 222 patients with symptomatic varicose veins and saphenous vein incompetence. In this multi-center prospective randomized study, early complications were mild and similar in both groups. Days to complete occlusions were significantly less in the cyanoacrylate groups, while days to recanalizations were not significantly different. At 1 year, physician and patient-reported outcomes were similar in both groups. So the authors concluded that cyanoacrylate-based chemical ablation had similar efficacy compared to radiofrequency ablation in terms of occlusion, durability, relief from symptoms, and quality of life at 1 year after interventions. The final paper we would like to introduce you is entitled Outcomes of Iliac Vein Stents Following Pregnancy, authored by Dr. Zari and colleagues from Pittsburgh and Bradford in Pennsylvania and Jackson, Mississippi. In this retrospective study, 12 of 310 women of reproductive age had at least one pregnancy after iliac vein stenting. One patient had asymptomatic stent compression after 2 deliveries. This was treated successfully with balloon angioplasty. At a mean follow-up of 61 months, all stents were patent without structural damage or thrombosis. So the authors suggest that iliocaval stenting is not contraindicated in women of reproductive age, or the close follow-up of this subset of patients, especially during and after pregnancy, is warranted. These were just a few of the many excellent articles from our May issue. To access these articles free this month, please download them on www.jvsvenus.org. Enjoy reading all JVS journals. Let us know if you have a good idea how to improve our publications. And see you next time for the highlights of the July issue of the JVS Venous and Lymphatic Disorders.